Good morning, ladies and gentlemen. I am Councillor John Robinson, Chair of this committee. May I welcome you to the remote meeting of the Adults, Wellbeing and Health Overview and Scrutiny Committee of Durham County Council, taking place on Friday, the 2nd of October 2020. It is being recorded live to the Council's website and will be available to view for a minimum of 6 months. Ladies and gentlemen, please be aware that any footage from the meeting can be used in subsequent media broadcasts. I would like to give a warm welcome to the members of Durham County Council, to the officers and any members of the public who are watching this live feed of this morning's meeting. Before we commence with the formal business of the agenda, may I cover some housekeeping issues which are as follows. All participants must mute the microphone. Please blur your background wherever possible. To speak, please use the chat function on the right-hand side and type RTS, request to speak. Please remember everyone in the meeting can see the messages in that chat function. When invited to speak by myself, please remember to unmute your microphone. And once invited to speak for the first time, could you please introduce yourself, your name and position. Once you've introduced yourself for the first time, following that, there is no need to do it. If connectivity fails, please switch off your video and use just the telephone function. If connectivity issues continue, you may have to leave the meeting and rejoin. If I fail and my connections fail, Councillor Rob Crute, Chairman of the Corporate Overview and Scrutiny Management Board, will take over. So, ladies and gentlemen, before beginning, I would like to welcome and introduce a number of additional key officers supporting today's meeting from Durham County Council, from the National Health Service, County Durham CCG, County Durham Care Partnership. First of all, can I welcome Councillor Mrs Lucy Hovels, who is the Cabinet Member for Adult Health and Wellbeing and also Chair of the Health and Wellbeing Board. To Jane Robinson, the Corporate Director for Adult Health and Social Services. For Amanda Healy, the Director of Public Health. Jenny Howarth, the Head of Strategy for Durham County Council. Mr Stephen Gwillam, the Officer responsible and assists us greatly in the Scrutiny Committee. To Jill Errington, our Member Support, who is helping us this morning. To Rachel Rooney, Commissioning and Development Manager for County Durham CCG. Joseph Chandy, Director of Primary Healthcare, NHS County Durham. Juliet Carling, Commissioning and Delivery Manager for County Durham CCG. Gillian Curry, Head of Communications and Charity for County Durham and Darlington NHS Foundation Trust. To Sarah Burns, Head of Integrated Commissioning, County Durham Integrated Community Care Partnership. To Michael Lang, Director of Integrated Community Services, County Durham Integrated Community Care Programme. Angela Harrington, the Strategic Team Leader for Durham County Council. And Andrew Gilmore, the Finance Manager and Adults and Health Services, Durham County Council. Good morning to all of you. A strong panel, ladies and gentlemen, for you to ask your questions to, and already waiting to answer. So if we can begin, Jill, item 1, apologies for absence. Do we have any?
Chair, we've had an apology from Councillor Charlie Kay.
Thank you. Do we have any substitute members?
We have no substitute members, Chair.
Okay. Well, may we then move on to the minutes of the meeting held on the 5th of March? It seems so long ago. Can we agree the minutes is correct? I've got nods around, so that's great. Stephen, could I ask you to come in on matters arising?
Thank you, Chair. Yeah, 2 matters arising from the meeting held in July. The first one, Chair, I'd refer members to minute number 6B, which was the report we received on the system response to COVID-19. As part of the debate at that meeting, we members did ask for additional information in respect of the discharges from inpatient hospital care of County Durham residents from other foundation trusts and the testing rates that were undertaken in respect of those discharges. Chair, that information was collated by Jane Robinson, Director of Adult and Health Services, and members will have received a letter earlier this week detailing the information that was asked for, Chair. The second matter arising relates to the minute number 7, the consideration of the work programme, and members will recall there was a request and suggestion for an additional item to be included within that work programme related to the COVID impact on adult social care. And just to advise members that there will be a bespoke item at our next meeting on the 9th of November covering that particular issue, Chair. So those are the two matters arising I'd like to draw to members' attention. Thank you.
Thank you, Stephen. Clearly, that second bit's important about the special meeting November the 9th. Do we have any declarations of interest? Anything, Rose? I've only got one co-optee here. Good morning, Rosemary. Nice to see you. Is there anything you wish to raise?
No, thanks.
Thank you. Stephen, anything you wish to raise that anybody else has raised with you?
No other items raised, Chair.
Thank you. So, item 6, Shotley Bridge Community Hospital. I know several members who are not on the committee but from that area have joined us, so welcome to them. But first of all, can we move over to Rachel Rooney? Good morning, Rachel. You're going to give us a report on this.
Morning, John. Morning to everybody. Yes, so I'll talk you through the report that was submitted as part of the Shotley Bridge Hospital update. Just to refresh members' memories, we have allocated £20.1 million for this scheme, and the last sort of period of engagement that we had with members of the public was back in spring 2019. Last time I spoke to the committee, we presented a series of timescales in terms of the project. However, this has changed in light of the pandemic, and I'll come back to some of those revised timescales later in the presentation. In terms of the project itself, we've continued throughout to have a reference group which Councillor Lucy Hovels chairs, with local members from the area present, and we use that reference group really to keep the members updated and to share progress. We also have a dedicated patient reference group which meets on a monthly basis, and again it's with interested parties from the local area, including the Save Our Shotley Bridge Hospital group, and again that group has proved invaluable throughout. We had pre sort of April had discussions with our local clinicians about future models of care, and as part of that we developed a proposed model of care that we wanted to go out to engage upon, and at that time we thought that that would happen in September this year. However, as I've said, due to COVID, normal activities were stood down to kind of cope with the pandemic, and therefore we have had to pick that piece of work back up again and re-look at it in light of ways of work and in terms of COVID. So, for example, the way in which we deliver outpatient appointments is changing, and we're doing as a system a lot more in terms of virtual appointments. But what we also saw during recent months was an increased use of Shotley Bridge Hospital, and indeed all of our community hospitals. The idea is that as a system, we wanted to try and keep as much activity away from the main acute sites as possible. And in particular, things like chemotherapy services were greatly utilised at the Shotley Bridge Hospital site. So these sort of considerations need to be taken into account, and we need to revisit that clinical model, which we are doing with our clinicians. Once we've come up with that proposed model of care, we'd like to go back out and engage with members of the public. This isn't ideal. We appreciate that in the current circumstances in terms of social distancing and the ability to hold physical events. However, we're also keen to progress with the scheme, as we know that this has gone on for a number of years, and we'd like to progress as swiftly as possible. We will come back to members of the committee in terms of a comms and engagement plan, and we'll share that with you for comment before we do any form of further engagement. But we're hopeful that we can start that engagement in November this year. Obviously, with all of this, and when I talk through some other timescales, there is a caveat on these, and that is around sort of we don't understand the impact of the next couple of months and how that's going to impact on our timescales and our ability to progress with the project over the coming months. But we are going to sort of plan for every worst case scenario, and we have built contingencies into that. In terms of the estate solution, so members will be aware last time I spoke about this, we had shortlisted 3 potential sites. They were land that's based in Ledgate. There was a site at the former Blackfine School off Durham Road, and the Genesis site, Puddler's Corner in Concert. And also the sort of current site and the redevelopment of that site. Since that time, we've worked further with Durham County Council Planning Department, and as a result have found that 2 of those sites are no longer viable for further development. So the Ledgate site and the former Blackfine site were deemed unviable due to sort of highways issues. And therefore that leaves us with 2 potential options to take forward to consultation. Those 2 options will be the current site and the redevelopment of that, and the Puddler's Corner site, the Genesis development. Over the coming months, we need to do further work because the assessments that we've done to date have been done on a non-financial basis. So we shared the criteria that we used for our options appraisal with the reference group that we have, who approved of that. We now then need to go into the financial element of that and review each of those sites on the financial sort of value for money assessment. Once we've done all of that work, that will then feature as part of our business case, which we'll take forward to consultation. And as part of that, we will have a preferred option on those 2 sites. I briefly mentioned some sort of timescales, but just to give an overview of those really. So we're hopeful that we can start public engagement in November. We're looking to develop our outline business case by March next year. And then we'd like to consult in June next year. And we're very mindful, obviously, that there are potential for local elections. And that's the kind of reason why we need to hang on till summer next year to allow for that purdah period. If all of these timescales are met, we're very hopeful that we can start construction in 2022 with a view to completing construction late 2023. However, as I've said earlier, that there are some caveats around those timescales. There are a lot of unknowns at present, but we are hopeful that we can progress in that manner. So I'm happy to take any questions, Councillor Robinson.
Thank you, Rachel. Rachel, this is a project that this committee has been clearly linked to and involved in, and we fully support Councillor Mrs Hovels, the local members in their work through the reference group. I think this committee has also endorsed the reference group and endorsed the work with you, and we are fully committed to the success of the project. And I do think, as an example for ourselves and other councils of the role and success of Scrutiny, is that this project has got this far with members, councillors, officers working so closely together. And I think congratulations has to go to every single one from Councillor Hovels down. So congratulations, Rachel, for the fact you got it here. And even more so, congratulations for having the Minister of State come and give his support. I've got Councillor Tanya Tucker wishing to speak first, then I've got Councillor Shields, and then also Councillor Temple. So Tanya, would you like to go first?
Morning everybody, thank you John. Rachel, my question is around the public engagement and the consultation process. Given the difficulties we have with face-to-face and groups, I'm just wondering, how you plan to have a comprehensive public engagement exercise, given the restrictions, so that it seems to have, well, not seems to have, but so that it does have a meaningful and full opportunity for the public to engage. And I just wondered if you could shed some light, please.
Thank you, Tanya. So,
Thank
Rachel,
you.
we tend to do 3 questions at a time, so I'll get the 3 speakers, and then you're off. So, Councillor Alan Shield, and then Owen. Alan.
Thank you, Chair, and thank you for allowing me to contribute. It's not so much a question; it's just a further update to supplement what Rachel has already said. And we've already had this conversation with Rachel at the AAP board meeting, but for the benefit of the committee, I think it's relevant that they need to be made aware of this as well. As Rachel has said, 2 of the estates have been excluded from consideration, one of those being at Ledgate, and I have bowed to the report by John McGargill regarding the highways issues. I have said to him, mind, if you can't build a hospital there, how is it earmarked for a new school and 292 properties? But that's a second issue. Also at the Ledgate site, we do have an anaerobic digester opposite, which is causing and still causes a lot of odorous smell problems. But the main issue, what I want to engage with the committee today, is about the site at Genesis on Puddles Corner. There is a report and an application to be submitted by the Genesis Trust for what is called an energy recovery facility. It's been interpreted as an incinerator, but it's classified as an energy recovery facility, which recovers and produces power from waste, some 60,000 tonnes per year. And the report from one of the directors states that it will provide heat and power via a local smart grid network to users on the Hounsgale Eco Park, as well as the newly planned health and wellbeing site due to be developed on Durham View. Now, as you can understand, as a member of that committee, as you are, that is subject to the approval of the planning committee, and therefore any consideration that the new community hospital will go on that site will be subject to the auspices of that committee. So that needs to be clearly aware. The last thing I'd like to raise, again, this was mentioned at the AAP meeting, is the sad demise of Derwenside Mind, and that in previous considerations with the reference group, we raised the issue about the Tees, Weir and Esk mental health team coming into the new facility, wherever it's going to be, but to bring their own finance with them so that we would have the benefit of not duplication, but supplementation. So I don't have a question, as I said, Chair. It was just to bring this relevant information to the committee so that they're well aware of the information. Thank you.
Thank you, Alan. Thank you. So we now move on to Owen. Owen.
Thank you, Chair. Councillor Owen Temple from Consett North. First of all, I think everyone will be slightly disappointed by delay, but we're living in a time where we have to live with disappointment. So that is just a fact of life. I particularly wanted to raise the issue that with only 2 sites, one of them being the existing site, and again, we said this at the AAP, but I think this committee here is crucial. It is, as it were, the county-wide record of what's going on. Just to seek assurances that if the existing site is being redeveloped as one of the possibilities, there will not be any interruption of the existing hospital services, because many people are worried that if anything were to stop at Shotley before we had what is new, it would be unacceptable. So it's really to get that assurance, and I'm sure Rachel will give it to us, to this committee this morning. And the final point actually picks up on Councillor Tucker's. Could I suggest that amongst the methods of consultation that we consider this time, we give greater prominence to the telephone. For many older people, the telephone is their lifeline through this crisis. It's not computers necessarily. So in addition to written materials and internet-based things, can we also make sure that we have a dedicated telephone line for people to feed their views into. So thank you very much for that, Chair. Of course, like others, I'm delighted that this seems to be becoming more and more real, and the Secretary of State having come and given his blessing, it would be very hard to walk away from. Thanks.
Chair, you're on mute.
See, Jill, that's why you need to be here. Yeah, I got the same comfort that I cannot walk away from this one when you get, you know, having gone there so well. Rachel, if you would like to answer them questions, then I'll come to Stephen, because I know Stephen can explain what our role will be in the consultation, etc. Thanks, Rachel.
Thank you, and thank you, Councillor Robinson, just for updating in terms of the OSC's input in this. We are very grateful for your ongoing the ongoing challenge that you provide to us, and also in terms of the visit from Matt Hancock. Thank you for highlighting that. Just to pick up on Tanya's, Councillor Tucker's point, we're very mindful that there are limitations at this point in time, and we are always seeking new ways of engaging with members of the public. So we do have a plan, but we're also very grateful for any outlets that local members are aware of that they can let us know that could be of benefit. We are also acutely aware that often the people who are using these particular services are people who are the most vulnerable in our communities and who potentially don't have access to technology. Councillor Temple mentioned the telephone line, and we do actually have a dedicated line that we use, and we use throughout the engagement for Shotley Bridge. It is actually a sort of answer machine that people can leave messages on, and we call them back on that, so people can do that at any point in time. We're keen to use existing forums that exist, particularly within our voluntary sector. We have a huge network of stakeholders that we absolutely appreciate and rely on to get these messages out to and to gain feedback from. And we're also hopeful in using our sort of providers of NHS and care services to deliver some of these messages for us and to seek feedback as well. So we are aware of the limitations. We're hopeful that we can still reach you know, open access for people to be able to feedback as much as possible, and we are going to keep that period of communication and engagement open for as long as we possibly can to account for that limitation. Just in terms of Councillor Alan Shields' comments, yes, we are aware of the renewable energy facility, and in terms of the work that we're doing with the particular developer of that site, that is being taken into consideration. Part of our policies include the need to look at renewable energy sources, but we also have to consider the needs of that a hospital places in terms of energy, and ensuring that we have consistent energy sources in that respect. Councillor Temple, just going back to your point about the current site and continuity of care, and I know that you have raised this on a number of occasions. This is something that we considered as part of the original options appraisal exercise. So it was built into our criteria around continuity of care. And again, when we go forward to do the next round of assessment, that will play a huge feature in terms of our scoring. We need to do more work around what the development would mean on the current site. Would it be about transforming the existing building, or would it be about developing a new build on an adjacent piece of land? All of this needs to be considered, and ultimately the impact on continuity of care and for our patients has to be you know, a huge factor in that consideration. So you have assurance that that is being looked at.
Thank you, Rachel. I've got nobody else to speak, so Stephen, after you, we'll wind this bit up.
Thank you, Chair. Yeah, the recommendation before members are to note and comment on this morning's report. I think that the issue for members is when there are plans for engagement and consultation, we usually ask for sight of those plans. And I think as a recommendation moving forward from this morning's meeting, we would formally request on the committee's behalf that those plans for engagement be shared with members for consideration and comment, so that we can undertake our usual activity in terms of commenting and shaping those plans, Chair.
Thank you very much, Stephen. So Rachel's nodding, so we'll get that. So thank you very much. So can the committee note the report and look forward to the next stage? Great, thank you. So we now move on to item 7, to probably one of the most busiest ladies in the whole of the country. Can we welcome Amanda Healy, our Director of Public Health? Amanda, I think we all would like to say thank you very much for the work you and your team are doing, and also to say thank you to your family for allowing you to be doing what you're doing. You seem to be so busy, Amanda, and there all the time. So Amanda, would you like to do item 7, the Outbreak Management Plan?
Thank you, Chair, and thank you for that welcome this morning. What I thought I'd do, Chair, was to just go through the front report, then give an update on our current data, and then go through each section in the local outbreak control plan in a little bit more detail, because it's probably been, even since this was published and updated at the Health and Wellbeing Board, there's probably more that's taken place, and then just go over some of the key issues that have probably happened in the last 2 weeks, and obviously then open it up for questions. So obviously the purpose of this report is to update the committee and to receive the local outbreak control plan and a progress update of the work. The work builds on existing health protection assurance arrangements, which this committee has been well aware of, and the health protection assurance group, which generally reports into this committee, as well as having a direct report to the Health and Wellbeing Board. And the purpose of the local outbreak control plan was to protect the health of local residents, particularly from COVID-19, and to reduce that onward transmission. Obviously, as the relaxing of lockdown measures took place in July, there was always an anticipated increase in the number of cases, and local authorities were asked by government to develop a local outbreak control plan and to publish that plan by the end of June, which County Durham did, and it was formally presented to the Health and Wellbeing Board on the 14th of July. Under the plan, it's overseen by a local health protection assurance board. That board's currently chaired by Jane Robinson, Corporate Director, and that's really to lead, coordinate and manage the work to prevent that onward spread of COVID-19. The Health Protection Assurance Board currently meets weekly, and I'll go through some of the updates from July in terms of the implementation of the local plan in a little bit more detail shortly. Obviously, as we know, although there's development of a vaccine, which is really promising, there is still no cure, and really that prevention and the stopping of that onward spread is our main action against COVID. And the key elements of this plan outline the things that we are doing collectively with our communities to try and reduce the spread and keep our rates as low as possible. So the plan provides a framework for leading, coordinating and managing the work, and it has some really key objectives to provide that prevention messages, and we must continue to go back to those very clear, simple prevention messages. The detection of COVID and outbreaks, and I'll update on some of the outbreaks that we've overseen and managed in County Durham over the last couple of months. To provide support to those who need to self-isolate, and building on our population health management approach to that, and obviously to apply intelligence. And obviously a key part of that work is to ensure that people can access testing, that can be contact traced, and they can self-isolate as quickly as possible. I'll go through the themes in the plan in a little bit more detail shortly, and just wanted to highlight the governance to the committee. The government asked us to have a public-facing board which should engage with the public, and it was agreed that board would be the Health and Wellbeing Board, as that has oversight of health and wellbeing priorities within County Durham. And the latest plan, which is the same plan that we have in the papers today, was presented to the board on the 11th of September. So obviously Councillor Hovels is here this morning, and Councillor Hovels has actively engaged with this plan, but also raised concerns and issues nationally where there are elements within the plan that we are finding a real challenge locally, and that has included issues on testing, the changes to the Public Health England to be changed into an Institute of Health Protection, and the test and trace system. The governance can be seen there, and also the elements of the plan. We have also received funding, and that is overseen by the Health Protection Assurance Board, and to support this local outbreak control plan. And I can give further details on the elements of funding that it's supporting. And part of that has been to appoint additional staff. So the full plan is there, and I'll go through some of the sort of give an update on the data, because obviously the data very quickly becomes out of date from within the plan, and obviously we have our Durham Insights website to keep people up to date as quickly as possible, and that is also developing very rapidly to use the most recent data. But I'll go through each element of the plan and then some current issues. So our current position in County Durham has actually changed pretty rapidly over the last few weeks. Our rate of cases was fairly low towards the beginning of September, and then we actually saw a very rapid rise in rates, and I'll come back to that in terms of how we managed outbreaks and then how it moved to community transmission. So our current rate of cases is 95.3 per 100,000, a 7-day rate, which is a rolling rate updated on a daily basis. And that does compare, it's slightly lower than some other parts of the northeast, such as South Tyneside and Newcastle, but higher than some of our LRF partners, such as Darlington. In the last 7 days, we've seen around 372 cases, and we're averaging around 60 cases per day. And in terms of where those cases are currently, they are now spread right across our communities. So we are seeing small clusters of cases of COVID right across County Durham, within households, within some of our schools, workplaces, and in different settings such as youth centres, etc. And however, they are all fairly small scale. I'll come back to some of the larger outbreaks that we've had to deal with. And I think so that rapid increase, and we are continuing to see that increase in rate of cases. And as I say, that data is available on Durham Insights, and we can obviously send the link to members. It is in the plan, and we've got that data now right down to middle super output areas, so all councillors can have a really good look into that data and what's happening in their locality. I just wanted to outline kind of within the local outbreak control plan, there were key settings that we were asked as local authorities to develop more in-depth plans on, and so what we've done under the Health Protection Assurance Board is developed small teams that link to each of the settings which are outlined in the plan, and I'll just run through some of the key areas of work that each of those have been doing. Our work's very much underpinned by joint work with Public Health England, and we've got a range of joint management arrangements for outbreaks. Public Health England and the Health Protection team at Public Health England are the specialists in terms of health protection, and they form the top tier of the NHS test and trace system. The lower tiers are the nationally appointed call handlers that deal with single cases if people become have a positive test for COVID and are followed up. So there are different tiers. So we work very closely with the Health Protection team in terms of those joint management arrangements. In relation to care homes, obviously there's already been very established work with care homes in relation to cases and outbreaks. So the infection prevention control team, colleagues such as the Sarah and Burns, who's the director for integration, of a mutual aid group that oversees any cases, outbreaks, testing in relation to care homes, and dedicated work with staff and residents to ensure that our cases are kept as low as possible. We also very recently, ahead of many other parts of the country, have had to restrict visiting once we saw some of our rates increase. So a letter did go to care homes to request the restriction of visiting to protect those vulnerable population. In relation to our schools, and when I say schools, I mean early years setting and FE as well, a huge amount of work has taken place in terms of planning to ensure that children and young people could return to the classroom, and for their teachers and for themselves to be safe, and work really closely with the education team to ensure that children could go back at the beginning of September. And I think what we've seen since then, I think we've had about 5 school closures. However, otherwise what we've managed is a small number of cases where there'll be a bubble of children and teaching staff that may have to self-isolate for 14 days. And schools are managing that very well and working really closely with education and with public health. And we take more specific advice if those numbers do increase. And I think what we're finding is that the transmission is actually taking place in more social settings rather than in the school setting itself. And obviously we'll be keeping a close eye on that. In relation to the university, that's been an additional element of our local outbreak control plan because of the high number of students at Durham University. They've worked very closely and have a very detailed, they have their own local outbreak plan, and are busy at the moment, obviously, introducing students back to the city, and similar to schools, are managing a small number of cases and looking at any linkages between those cases. Healthcare setting, our colleagues within healthcare, again, have got single point of contact for any cases that are identified within healthcare setting, ensuring access to testing, and making sure that any outbreaks are identified very, very quickly. We do have a group under the local outbreak control plan which focuses on our high risk locations and our communities, and that will include obviously our prison population within County Durham, and which there are no cases currently, but also looks at geographical locations or particular communities because of their behaviours or the lives in which they live. They may find it themselves more at risk. So that's particularly focused around our people who may be homeless, or Gypsy Roma traveller community. And I think right through this, throughout all of our outbreak control settings, is the whole focus around engagement, that continued work with our local communities and communication. We have then an additional section within our plan which is focused on our workplaces and really close working with colleagues within Business Durham, linking to small businesses, but also our environmental health colleagues. So Joanne Waller, Head of Community Protection, has done a huge amount of work with her team, ensuring that businesses can be COVID secure, but also at this point in time looking at the licensing and any restrictions on licensing and compliance to either venues or businesses that are not COVID secure and are putting people at risk. So a vast amount of work taking place with certainly Joanne and her team, and now obviously in terms of compliance and enforcement with police colleagues as well. A key part of the plan is testing, and we've obviously discussed testing at the previous Scrutiny Committee. We have, as part of the NHS Test and Trace, we do have access through the NHS lab space for NHS staff and for some of the council staff. We've got access to mobile testing units across the county, and we now are busy setting up local testing sites that are slightly longer term and will hopefully see us through the winter. We know I've already mentioned some of the challenges, and we have experienced some of that recently in terms of people, our residents, being asked to go for testing to other parts of the country, such as Galashiels and Carlisle, which is obviously unacceptable. In terms of contact tracing, so that ability to, as soon as someone has symptoms and is tested positive, to ensure that they can be followed up and their contacts followed up. We know that the level 2 call handlers reach about 60%. So around about 40% of people are not followed up and contacted within that first 24-hour period, which is critical. And again, we're working with colleagues within the Contain team nationally to try and address this. A very, very important part of our plan is the vulnerable populations, and I think we've been extremely fortunate in County Durham in terms of our County Durham Together, which was traditionally the community hub, and how our County Durham Together has worked with, you know, a huge range of voluntary sector organisations, local groups, mutual aid groups, to provide that ongoing support, and that is back in place now for people who do need to self-isolate if they are affected by COVID. We have also lobbied nationally to ensure those self-isolation payments as well. So our community hub has played a really, really key part in supporting the vulnerable populations, not just those from COVID, but multiple vulnerabilities from domestic abuse, for example, to ensure that people are reached, and of course the shielded population. I think then, I suppose, a key part of the local outbreak control plan is escalation and what happens when and if cases increase, and obviously that is what we have seen. And the Contain part of government did produce an escalation framework. We've looked at that locally, and we moved quite rapidly through that escalation framework. I think at the beginning of kind of August, beginning of September, what we were seeing was specific outbreaks. So members were updated, and obviously that we went to public appeal for an outbreak at Stanley Empire Social Club, and then we had a significant outbreak at Burnside Working Men's Club, although the majority of those cases actually fell within the Sunderland boundary and affected Sunderland residents. Concert Working Men's Club, and I think at that point we were able to contain the outbreaks through our usual management routes. However, I think as transmission has spread, what we're now seeing is community transmission, and I think that huge increase, I think we saw about 160% increase in cases between the 2nd and the 8th of September, resulted in us working with other local authorities across the LA7 group to look at what potential additional measures needed to be put in place. And I think within County Durham, because of the real increase, it was partly a preventative measure to stop us going any higher, seeing some of our neighbouring authorities with an even greater increase in cases. So obviously there was a round of negotiation and restrictions introduced on the 18th of September. They were due to be reviewed today. We were called to a meeting last week with the Chief Medical Officer, and they were reviewed very rapidly at that meeting with the Chief Medical Officer when extreme concern was expressed for the rapid increase and continued increase in rates. And that is where additional restrictions came in. Alongside those restrictions, there has been a specific support package requested of government in relation to resources to support the implementation of those restrictions, and that those discussions are ongoing. So I think that is where, Chair, we are at currently, and hopefully that gives an overview of the local outbreak control plan, some of the issues we're facing locally and how rapidly things can change, and obviously where we find ourselves now is in an area of intervention with those additional restrictions. And at this point, it's still, we're only 2 weeks in. I think we would start to see, hopefully in the next week, if those restrictions are starting to have any change and impact. Really difficult though they are for our local residents, and confusion over the last week, I can completely understand that, and how we engage with our communities again to ensure that people can continue to do the right thing to stop the spread of this virus is going to be really important going forward. Thank you, Chair.
No, thank you, Amanda, for your report. Amanda, you refer to the link. Could we take that off for all our members, including our co-opted, to Mrs. Masoon, to get that link? You talk about Public Health England. This is the first meeting we've had, and I know, in fact, I've invited Councillor Hovels to address us at the end of this item, because I know a lot of members feel we should be supporting Councillor Hovels, who's wrote off. One question I've been asked to ask Amanda is, in the report, there's no reference to local councillors. Local councillors have told us they are you are the link to the community. You're the link to the community. You're the link to the towns and parishes. What role do local members play? I've been asked to ask that because it doesn't appear in the report. And then I don't know whether, unfortunately or fortunately for you, you've got 6 members wanting to ask you questions. So do you want to answer that one, Tanya? Then we'll go to Amanda, then we'll move on to the members.
Yes, of course, Chair, and yes, we'll absolutely get, because the more that we can get, obviously, local members using the dashboard that we have published and the information that's publicly available, the more informed that local elected members can be. Obviously, the Health and Wellbeing Board is the public facing engagement board for the local outbreak control plan, and through our work of the Health Protection Insurance Board, I think with local members, absolutely, you know, their eyes and ears and assets and in relation to local communities. I think obviously what we've tried to do is ensure that through kind of all member briefings, people are kept up to date. We do have the public facing dashboard that we're trying to get down to as low a level as possible and keep that data up to date, recognising that we have a lag in data as well. What we've also done, Chair, is when we have had those very specific outbreak situations such as Stanley or Burnside, we've actively engaged with local members, and again they've been really part of the response to those outbreaks, and I would hope that we would continue to do that. I think now we're into that kind of more widespread community transmission. We are setting up a community champions programme, and again drawing on some of the volunteers that were part of the volunteering link to the community hub, and what I would hope through that programme as well is that local elected members, our APs, would continue to be that voice into local communities. And obviously any other suggestions that members have about how we keep people up to date, we're happy to take that on board, because we've got a very specific communications and engagement strand of the local outbreak control plan.
Thank you, Amanda. Okay, I've got a number of members, but Stephen, you've come in there. Do you want to go first?
Thank you, Chair. It's just in respect of accessing the latest statistical information via Durham Insight. I just refer members to the report that Amanda's included within today's pack, and specifically to page number 37 in the full pack, page 7 of the specific plan. And within that, there is a direct link to Durham Insight, and if members clicked on that, you get access to the data that goes up to actually yesterday. So there is a link built into that document where members can access the latest data. So we can circulate a link separately, but it is accessible through that document, Chair.
Thank you, Stephen.
Thank you.
Thank you. So here we go. I may have to alter the list around because Councillor Mrs. Brown did indicate she needed to leave. So if we get anywhere near the time when Liz has to leave, I'll play around with the list. But the first 3 who were registered with Councillor Mr. Bell, Councillor Mr. Turnbull and Councillor Mrs. Joplin. So we'll take them 3 first. Richard, would you like to go first?
Thanks, Chairman. Yes, Councillor Richard Bell, Barnard Castle West. Just on the subject of the link, I may be being dim, I frequently am, but I've gone into the Durham Insights website and I cannot find positive case data down to ward level. I can find lots of stuff about shielding and what have you. So I must request that we have a specific link that takes us down to ward level positive data, not just to the Durham Insights website. Because if I can't find it, I suspect other people won't be able to either. And that's quite important. I have, by searching, found a link that takes you to, not on Durham Insights, somewhere else, takes you to middle super output areas. And we do need to start moving the debate on a bit, I think, a bit from generalised talking about County Durham to like data within County Durham, because that data that I'm looking at here up to the 27th of September shows, for instance, the hotspot in Shildon, 45 cases, yet just down the road, Bishop Auckland, Central and West, it's 0 to 2. So it's a real sort of patchwork quilt. So I do think that we need to move the debate on a bit into a bit more granular level. But please, can we have a link that takes you to the actual positive cases for MSOAs, not just a general website? My question really is about the additional funding that Amanda referred to. She said we've had some funding and some more staff appointed, and I've heard about some new corona wardens and things being appointed, but also regarding the new restrictions, she said you're in discussions about additional funding for the new restrictions. So I guess the question is, what funding have we had, what funding would you like, and what have you spent the money on so far? Thanks, Chair.
Thank you, Richard. Owen?
Thank you, Chair. Can I thank Amanda and Jane, actually, because I think my question may be directed in some ways towards her for all the work that they've done. And can I thank you too for your question about the role of councillors, because just as an aside, I found out about Consult Workmen's Club. I'm not a big social media user, so I found out from a notice on a local community centre door. So it has felt quite disempowering, I think, during this COVID crisis. My question actually is about care homes, and it relates to something I was going to raise on the minutes as well, when they came up, but wasn't quite able to. So I completely understand the emphasis at the moment on control, but I have had, and I think most councillors would have had also, a lot of heartfelt, heartrending appeals from relatives of people suffering from dementia in care homes, relatives of every other resident of care homes, about visiting. So I completely understand that at the moment, this is in a way not the time to be talking about it, but as part of the management of COVID, I think I would really appreciate it if, when we get to the concentration on the adult care sector in the November meeting, if that question could be addressed about how we balance control with the humane need of people for contact. So I'm not asking you now for a kind of an immediate answer on what we can do, but some sort of plan for how we might enable that human contact to take place. And so I was wondering whether, and I think this is where it comes to Jane, with that emphasis on the November meeting, I think it would be helpful if councillors on this committee and any other councillors felt they could feed into you the things that they would like to see addressed within that. And for that, I think we need a deadline. We need to be, you know, so that the people who are preparing the report aren't asked to work blind, but equally that we feel as though we have some input into some of the things that are looked at within it. So could I ask perhaps Jane to give us a deadline? Is it to her we should address anything like that? And can we include this question of how we manage the humanity of contact alongside the obvious need for control of the virus in care homes? Thanks, Chair.
Thank you, Patricia. Are you there, Patricia? No, we've lost Patricia.
Yes,
so
no, you haven't. You haven't. Oh. Sorry, I forgot my mic was on mute. What I'd like to ask a question, it's to do with the testing. Much has been said about test and trace and its downfalls and all the problems with it, but it has been becoming very clear that lots of people are getting tested that don't need to be tested. And I wonder how or what we are doing at the moment to try and screen that, because I had a very bad cold a little while ago. I rang the doctor, he asked me several questions, and I'm in that group that has to watch what she's doing. And he told me it wasn't COVID, and it wasn't. So obviously, if you speak to a doctor, they tend to go through things more thoroughly. How, when someone rings 111 and wants a test, how's that playing out so that we can try and screen the people that really need a test and get, you know, stop the system being blocked up with queues of people that don't actually need a test.
Thank you.
Thank you.
Okay. Thank you, Patricia, Owen and Richard. We're over to you now, Amanda, and I'm quite sure with Jane, if she wants to come in, I'll come in, but should we begin with you, Amanda?
Thank you, Chair. Thank you for those questions. I think Councillor Bell, in terms of data, absolutely, we'll circulate the direct link into the dashboard, which is really important, and we are releasing that on a daily basis on social media now as well. I think it's absolutely right that we look at it at lower level and rather than just across the county. However, I suppose my health warning with that in terms of if areas look quite low is because at the minute where we have community transmission that it can change very quickly. So we do absolutely need to keep going with both the interventions that we have in place and the very basic simple messages around hand hygiene, social distancing and respiratory hygiene. In terms of the funding, County Durham received a COVID grant to go with its local outbreak control plan of 4.5 million initially, and that's been overseen through the Health Protection Assurance Board and has been used really to support some additional capacity across teams. So we do now have a dedicated outbreak control team to enhance some of the support within the environmental health team, to support additional capacity in infection prevention control, particularly for our special educational needs disability schools, to support some of our commissioning, and are now looking at that also in terms of that community side of things and communication. So that's updated and is overseen by the Health Protection Assurance Board, and a full update will be given to the Health and Wellbeing Board at the next meeting. The additional funding that has been requested of government has been part of a package that was put forward when additional restrictions were being implemented. And again, that has covered additional test and trace, compliance, enforcement, communication. And what was also asked for was support for businesses and the community sector in relation to additional restrictions that may make it very difficult for them to remain viable. So that was the package of support that was put to government and has been looked at currently, and we're awaiting the outcome of that. So moving on to Councillor Temple's question, I do apologise, Owen, that the first that you saw was a notice, because we have really tried actively to engage with local members when we have outbreaks. So we'll definitely take that on board, because it has also been where we've had our local community organisations and really taking part in trying to slow that spread and communicate to people if we've needed people to self-isolate. So we'll absolutely take that on board and ensure that takes place as we go forward. Jane, I see Jane, do you want to come there in terms of care homes?
She's flagged up she wants to come in, Amanda, so we wouldn't dare not.
Thank you, Chair. Good morning, members. It's nice to see everybody this morning. Yeah, thank you, Councillor Temple, for your question, and I totally understand the concerns that families would have in terms of the visiting arrangements. I think in respect of your question, specifically around the session that we have planned for next month, we felt, and I think we reflected it in the last meeting, that it would probably be helpful to do a kind of a much broader presentation around the whole breadth of social care and the frameworks that we operate within. But I'm happy to take any questions or points that councillors would specifically like us to consider in that context. I can certainly feed in the point that you've already raised, Councillor Temple. I think just with the timeline, you're asking that if people could come back to me by Friday the 9th of October with anything specifically, then we'll be able to do our best to feed that and build that into the presentation for November, if that's okay, Councillor.
Thank you very much, Jane. And I also think as well, on no criticism, Owen, that we shouldn't just focus on care homes, because certainly my family were dramatically affected by not being able to visit relatives in hospitals. and believe me, that I know exactly what he's saying, but it's not just care homes, it's hospitals as well. Thank you very much for that, Jane. We've now got 3 more lined up, but then 2 after. We've got Councillor Tucker, Councillor Liz Brown and Councillor Stevenson. Tanya,
Chair,
would you like
my
to go now?
question hasn't been answered.
Oh, I beg your pardon. This was Amanda. This was Patricia asked about people being tested who really shouldn't be.
Yeah, no, I think it's a really valid point, and what we are finding, what we've consistently, all of our communication has really stressed about on symptoms, so only to test on symptoms, and where we've seen an increase in cases, we've put that into our communication. We found a little bit of that, particularly when schools went back as well, that understandably with children with all different kinds of symptoms, were ringing their GP and GPs, and one was being overwhelmed. So we developed a flow chart with colleagues in the NHS that went back out to schools to encourage people to really think about the difference in symptoms. And so we're actively promoting that, and when we're getting soft intelligence, so we found that actually there was some information going out through football teams to send football teams off for tests regardless of whether they had symptoms or not. So, and then we were able to kind of engage back with the FA and the clubs in terms of that. So that soft intelligence in relation to that is really important as well, but we've just got to keep that really clear message that only testing on symptoms, and to try and screen people out as much as possible. So thank you.
Thank you, Amanda. Thank you, Amanda. Thank you, Patricia. I apologise for not getting the answer. Tanya, would you like to go?
Yes, thank you, Chair. Amanda, just briefly, your team must be working really, really hard. So I just want to express the wish that you're looking after your own health and well-being as much as you are looking after ours, and getting the appropriate amount of rest. My question is a follow-on from Councillor Joplin's. It's about testing. Because people are being tested quite vociferously, we've had a period where tests weren't available. So my first part of my question is, do we have the capacity to release or to have more appointments for people who actually do need a test? Because the last couple of weeks, I know a number of people who've been unable to even get a postal test or a drive-through or even a walk-through, and it's been quite difficult. So they've had to isolate, not knowing whether they've actually had the virus or not. My second part of my question is, the self-test is entirely reliant on you as an individual carrying out the swab accurately. As someone who's actually been tested, one of the things I was told was, if you don't carry it out accurately, the swab can be compromised. And I'm just wondering, if the swab is compromised, will that give a negative result, or does it still have the ability to give a positive result if that's the case? And how accurate are these self-tests, given that we as individuals aren't healthcare professionals, and we're flying blind, and when you're in your car doing a drive-through test, the only thing you've got is your little inside mirror to try and carry out a test that is quite difficult to do. So those are my questions. Thank you.
Thank you, Tanya. Liz, we got you there before you left. Liz Brown.
I wasn't going to run away, John. First of all, Amanda, thank you very much for all you and your colleagues are doing. I'm Liz Brown and I'm a councillor for Neville's Cross, which is one of the city centre wards. My residents are contacting me, telling me they're frightened to go into the city because of gatherings of students. Can you reassure me that the university is doing all it can to stop the spread of this disease? Thank you.
Okay, and the last of these 3, but I promise Christine and Shirley, you're next. We've got Jeanette Stevenson.
Good morning, everyone. Jeanette Stevenson, Anfield Plain Division. Firstly, I would like to say to Amanda and our team, thank you very much From a school's perspective, I'm a governor for 2 academies and for 3 primary schools in my area. And I've been really heartened to see the support that have been given to those schools. And the majority of them have actually had outbreaks, but they've been able to manage them effectively. And so thank you for that and the support that you've given them. My question is with regards to non-compliance, both in business and the community with regards to the new local lockdown rules. Are we seeing a significant number of cases of non-compliance in all settings? And how are we dealing with enforcement, with regards to partnership with the police and, other sort of people who might be able to do that sort of compliance enforcement? Thanks very much.
Thank you, Jeanette. There you go, Amanda. 3 for you.
Thank you, Jen, and thank you for the kind words. I have to say, definitely it's a all team approach right across the council and partners kind of working on this. I think in response to Councillor Tucker's question in terms of the capacity around testing and the ability to get tests, I think that was one of the reasons why we did go with the LA7 as a group of local authorities, because if we hadn't, we would actually have found testing capacity taken away from us and diverted to other areas where there was a greater need, because it was being limited at a national level. However, what we would want to hear about was any instance where people haven't been able to actually get a test. We were actually able to use a very specific example on the call and in discussion with government from one of the other directors of public health who was a Durham resident who was trying to get a test. So we were utilising that very directly with the Chief Medical Officer to ensure we can get that access to local tests. But if anyone's got those examples, please send them through, because we will continue to pressure for increased access to testing and testing in a different way, so that it's much easier to walk in, obviously, and not just a drive-through arrangement. So any of those examples would be really important. Tanya, what I might have to do in terms of the swab accuracy, I would hate to give you false information, so if it's okay, I'll go away and get the specific response in terms of the if it's not carried out correctly, what's the failure rate, etc. in terms of that. So if that's okay, I'll take that one away and come back with a specific answer to that question, if that feels okay.
That's more than fine, Amanda. Thank you very much.
And Councillor Brown, in terms of the Durham University, I think Durham University have, they have taken the return of their students extremely seriously. They were waiting for national guidance. They've been part of a northeast group of universities looking at their plans. They've obviously been part of a group with local community and residents association, sharing obviously and the concerns that people have about the number of students that are returning to the city, as well as trying to ensure that it's still a welcoming place for students. Obviously, the last thing we want is residents to feel frightened as if they are afraid to actually go out into their city. And I'm liaising with the university this afternoon, and we can certainly pick that up. But they have done a huge amount of planning. The Cabinet Office carried out a 2-day visit last week, and one of their days was focused on the university, and looked at their plans both for the colleges, but for the students who live out, how they will support them if they need to self-isolate, and obviously their bubble size, and in terms of their household sizes as well, and also what to do in an outbreak situation. And we are seeing a small number of cases coming through from the university, just as we are in local community. So I think it's going to be an ongoing piece of work with the university. And again, that probably leads into Councillor Stevenson's question around a little bit more around the kind of support, but then what happens from a compliance point of view. So certainly in terms of compliance, the university themselves are doing a lot of work, and they're appointing staff to, particularly with the nighttime economy, to look at compliance with social distancing and the new restrictions. But then obviously our licensing teams are out. So over last weekend, I think they carried out about 200 visits in and out of different bars, restaurants, and are working actively to both encourage businesses, because we've got some really good examples where workplaces and businesses are COVID secure. They're supporting their members of staff, they're ensuring people are safe in the workplace, but also now giving a clear message that after that engagement and education, that will, if it continues not to be adhered to, there will be obviously enforcement and that will go with that. Under our local resilience forum, a compliance cell has been established, and that will be a joint group of people with the police, our local licensing officers, and they will be working collectively to look at both the carrot and the enforcement side of things. It is a last resort, obviously educating and working with both businesses, and you know, we've had certain outbreaks linked to bars, clubs, restaurants, but that kind of support for those then moves into the enforcement if that doesn't take place, and colleagues are actively looking at that at the moment.
The last three, Amanda, I've only got 3 people left. Christine, Councillor Wilson, Councillor Quinn and Councillor Bell wants to come back. So Christine, would you like to go? Christine?
Sorry, I'm just unmuting. Thank you, Amanda, for all your information this morning. My question is simple, really. When I go shopping, I wear a plastic visor. Are they all right to use on their own, or should you have a mask underneath them? And B, should shops tackle people or approach people who aren't wearing masks in the shops?
Thank
you, Christine. We've now got Shirley Quinn.
Yes, thanks, John. Shirley Quinn, Shildon and Dean Valley ward. I've got a couple of things to say. First of all, it's about the homes. A couple of members have mentioned about the nursing homes and relatives not being able to visit the loved ones within the homes. I can assure you that I would think that most homes will have their own policy. Obviously, you know that I work in a nursing home, and our policy is that we make contact with members of families and what have you on a weekly basis. That's diaried in, and the staff phone them. They get the opportunity to be able to speak to relatives. Obviously, that's not appropriate for everybody. Those with really severe dementias wouldn't know if it was family members or somebody selling them electricity, say, for example. You know, so I mean, things are done on a sensible basis. It's reassuring also that policies changed as well, that to allow people at end of life to have the relatives visit them again. The lockdown is still in place. Members of the family are disencouraged to visit for everybody's safety. And don't worry, all of the staff, you know, I've argued this argument out. We know that people need family members. We know that they need that contact with them, but we're there to be able to provide everything that families can't at this moment in time. So that was one thing. And the other one is, it was mentioned about Shildon being one of the hotspots lately. My concern is, speaking to the younger people of the town, because the pubs in Shildon are closed, and some of them are closed as a precaution rather than the fact that they've had cases that have been confirmed. They're now going out of the town, and they're openly going out of the town because they still want to socialise, and that is a great concern. And I don't know if there's anything at all that we as a group, or Amanda and Jane and the team can be actively involved in, but I do think we need to be trying to dissuade people from moving from town to town, especially socially at this moment in time, when unfortunately that is the hotspot. Thanks very much.
Thank you, Shirley. And finally, Richard Bell.
Thanks, Chair, and thanks to Amanda and the team for all the work that they're doing. Just attempting to sort of like wrap up some of these questions, I think. I just checked the stats, the national stats yesterday, and only 1.5% of those people tested are actually positive. So I think Patricia's point that there's clearly a lot of worried well or people getting tested, there's something wrong. It seems to me we're not testing frequently enough people who need to be tested, and there's obviously a lot of people getting tested, and these are people who think they've got it, not the general public. So that's an incredibly small number of positive tests out of those carried out. But I think the thing to remember on testing is that most people, and I haven't got the number for this, but most people who are positive are asymptomatic. So you're only going to get on top of this by actually the control measures and people abiding by the control measures. And just finally, to pick up Shirley's point about the pubs, there's an awful lot of chatter on Facebook from people in the hospitality trade saying we are rigorous, we are complying, we do all the right things, and we are being singled out. Yet in shops they're not. And it does seem to be my observation that the supermarkets have slacked off somewhat in terms of the hygiene and the wiping and the controls that they used to do. I've seen big burly blokes going into shops that I feel like challenging, but frankly, John, I daren't, even though I'm quite a big bloke myself, but I'd be very surprised if they were asthmatic or had some kind of medical exemption, and nobody is challenging anybody in terms of shops and masks and things like that. And to me, I think that I can't put numbers on it, but that is my gut feel from where the issues are now. It's shops, frankly, not hospitality. And I do worry that the more we bear down on the hospitality, the more people are going to start, frankly, going to pubs elsewhere, or they're going to have parties in their own houses or whatever. So I don't know if Amanda wants to comment on that, but I know there's no magic bullets. Amanda, else would have found it by now, wouldn't we? But thanks anyway.
Okay, there we go. Amanda, all yours.
Thank you, Chair. I think going back to Councillor Wilson in terms of the plastic visor, I think in terms of face coverings, I think face coverings are slightly more effective, but the visor does obviously help because it does put that barrier between yourself and other people. I think the issue around tackling people in shops who either aren't practicing social distancing or not wearing a face covering, it is really challenging. I suppose it comes back to it is everyone's responsibility to try and, you know, either have a quiet word. It's very difficult for you know, staff in shops to do that as well, although they are encouraged to ask people either to practice social distancing, to use their one-way systems, to wear face coverings, or to show evidence if they've got an exemption. So I think it's something about us getting back to that. It's everyone's got to do their bit. I think Councillor Quinn, in terms of children, I think that's a really interesting point about people going outside of children, and we're certainly looking at that rise in cases and potentially further work around communication and community engagement. So we'll no doubt be back in touch, although there has been a slight increase in the last couple of days. So we'll certainly look into that, and we'll come back to yourself as a local member in relation to that. And then I think, you know, in terms of Richard's question around the people who are testing positive, at a local level, around about 6% of our population who are testing positive. So we're actually seeing a higher percentage than what is being tested nationally. I think that the mixture of restrictions can be confusing to people. I think what we know is that indoor spaces and between households is where we've seen a lot of transmission. I think then obviously what we've also experienced is that transmission in the hospitality sector, particularly when people have had alcohol. However, it is a massive sector of our economy in the northeast, and it's a really difficult balancing act in terms of obviously health, trying to keep people, we've talked about schools this morning, trying to keep our children in schools and the economy going. And I think there are, in terms of retail, while we've seen less outbreaks, for example, I think that reminder of everybody needs to be as stringent as possible at this point in time. Otherwise, there would be further restrictions, and I don't think we would have any choice over those. So I suppose that's really the final point, is back to, it is down to all of us acting collectively. in terms of the washing hands, social distancing, and trying to abide by the regulations and the guidance that have been put down, because we want to be through this and out of it as quickly as possible, so that we can get back to seeing our loved ones face to face, not just down a computer screen. Thank you, Chair.
I'm sorry, Anne. Amanda, there's one just come in extra. Councillor Reid, Anne.
Thank you, Chair. My name's Councillor Anne Reid and I'm the County Council for the Crook Division. Thank you, Amanda, for all the information that you've given so far, and thank you for all that good work that you and your people are doing. I just wondered if you could just help us with just one issue. In the recent times, we've actually seen protests throughout the country for one issue or another. In the Crook Division, we have got a planned protest, which is to go on outside of the council offices in Crook. I'm just wondering, well, whether one, it's lawful, and secondly, what measures can be in place so that if that protest does go ahead, that the people in the protest are kept safe, and the people who shop in Crook on the Tuesday, which will be a busy market day, will also feel safe and not intimidated by such a, which I believe is going to be a huge protest with regards to public houses and the businesses. Thank you.
Yeah, thank you, Councillor Reid. I think, yeah, obviously planned protests are lawful, but it is managing them in as safe as way as possible, and that's liaising closely with obviously our public protection staff and with the police. So what will ensure, obviously, ensure after today is that local members are given kept up to date with what those plans are and how the police and local authority colleagues are going to make it as safe as possible, and the what ifs in terms of if people weren't practicing social distancing, for example, which is what protesters do have to do. So we'll make sure that obviously local members are fully up to date with those plans around that planned protest. That's okay.
Yeah, that is. Thank you very much. Is there anything that I can do as well, or will you be doing? That
would be part of it. So what we'll ensure is that as local members, you have that briefing in terms of anything that you can do or information that you can give out in advance for local residents as well. We'll make sure you're kept up to date. Thank you.
Oh, thank you very much for that, Amanda.
No.
So Amanda, we're there. You can breathe a sigh of relief. You've got no more questions. Amanda, there's two things come out of today. One is clearly members would like more information on their own wards involvement, but a massive thank you to you, to Jane and your team for everything you're doing and for what you're doing to protect the people of Durham. I really do appreciate it. Thank you so much, Amanda.
Thank you.
Jill, I've not missed, and if you didn't see there, Amanda, there was thumbs coming up all over. You've got the thumbs up. Jill, I haven't missed anybody out, have I?
No, Chair. Everybody who registered to speak has had the opportunity.
Thank you very much. Okay, Councillor Hobbles, Lucy, clearly we've heard about Public Health England. Is there anything we can do to support you? Because I know you've been actively campaigning in support of Public Health England. Is there anything you would like from the committee?
Yeah, I think any support you can give would be very, very welcome, because it will have a major impact on the work that you do, and obviously we're doing right across the county, because the public health team actually do look after immunisations, the sexual violence, the stuff and the work we're doing around the water fluoridisation, and I think it's all important stuff, and we don't want it to be lost. But just if I give you a bit of background, we did have the joint letter from all councillors from the Health and Wellbeing chairs go off to Matt Hancock, which unsurprisingly, we don't seem to get any response back. That's the third letter I've wrote to Matt Hancock on the people's behalf and behalf of the council. So I am quite disappointed by it. However, we've got to keep pushing forward. There's a regional chairs health and wellbeing network set up, and we have the public health on for the next agenda, which will be in November. The problem is the way it's being done. I feel very disappointed, and I think I need to share that with you. The staff read about it in the newspaper or they saw it on the telly. There'd been no communication, no consultation with the public health teams. It was just announced from the government, and things were put in place, and no discussion with local authorities wherever across the country, never mind the region. So I do have real concerns, and it's expertise that we lost. Public health don't work in isolation. They work with all council departments, and they help influence change of policy. And I don't need to tell you that. You know, you've experienced with your 20-mile-an-hour zones around schools, the no smoking around play parks, all kinds of things in lots of different ways. Health impact assessments done on most policies that come before you. So I think anything that we can do to shape, because I think the government's quite sure this is what they're going to do, but I do think we should be having a seat around the table and influence some of them changes and be part of the discussions that taken place, which we haven't been. So I really felt it was important to share that with you.
Thank you,
Chairman.
Thank you, Lucy. And perhaps if members agreeing, Stephen, Lucy and I will get together to see what we can do, either letter or whatever support we can give Lucy. Can we agree that? Thank you. Thank you very much. So we now move on to the next item, item 8, which is the report on primary care update. Now the report says from George Handy, and I know Joe's here. Hello, Joe. But I understand Juliet Carling is going to present it. So good morning, Juliet.
Morning. Thank you, Chair. Just before I go through the report, Sarah Burns has asked me to provide a brief update that sets out what the 3 levels that we work at across the North East. So around the integrated care system, integrated care partnership and primary care networks, and how they all work together. The integrated care system, which is ICS, is regional. The integrated care partnership, ICP, is sub-regional, which is County Durham, Sunderland and South Tyneside. And place is County Durham. The majority of work happens at place, and it is what we consider our priority within County Durham. So the NHS long-term plan, which was published in January 2019, required organisations to have integrated care systems in place by April 2021. The integrated care system for the North East and North Cumbria, known as the ICS, is not a statutory organisation. It is made up of individual organisations that work together across a range of individuals, such as prevention. Across the North East, there are 3 integrated care partnerships, which cover the South, Tees Valley and Darlington. Central is Sunderland, South Tyneside and Durham, and the North is Gateshead, Newcastle and Northumberland. The ICPs focus mainly on acute services and their sustainability and how our acute providers can collaborate. The County Durham Care Partnership is our place-based partnership. Health and social care organisations who work together in collaboration to ensure that we deliver joined-up services for our population by integrating where we can. And primary care networks are groups of practices that work together at scale. This helps to improve the ability of practices to recruit and retrain staff, to manage financial and estate pressures, provide a wider range of services to patients, and to more easily integrate with the wider health and care system. We have 13 primary care networks across County Durham. So that was it for that bit. So the purpose of the report today really was to highlight to the committee the response from the primary care service during COVID and the reflections as a CCG that we've undertaken. You'll see from the report that the primary care has shown great resilience and adaptability in transforming the way it's been working. And as a result of this, there is a requirement to mobilise some elements of the draft primary care strategy at a rapid pace. So an example of this is practices introduced total triage. We moved from a model of almost entirely face-to-face consultations to almost all consultations taking place via telephone, online. And what we've seen is a greater increase in the use of e-consult. We also had to bring forward work with care homes ahead of the network contract direct enhanced service timelines. This has included GP practice alignment to every care home in County Durham, along with a named GP and nurse. A lot of work has been undertaken in care homes to provide them with the facility to undertake online consultations with the named GP. And they've also recently had NHS emails set up to ensure we can safely deliver confidential information between practice and care homes. We also had to set up very quickly hot hubs. So these were designed designated sites where patients with suspected symptoms of COVID could have a GP face-to-face appointment safely. And although these have been stood down, primary care is ready if necessary for these to be set up again. So as we start the transition towards a new normal, we have an opportunity to embed at scale or escalate those changes in primary care. And we're now in the process of refocusing our commission and priorities and our primary care strategy. So as part of the refresh, we need to make sure that we ensure that positive transformative changes are mentioned, as mentioned, are not lost. And we need to ensure that we take the steps to lock in these improvements moving forward. So the areas that we're proposing to focus on are supporting patients to self-manage where appropriate, to increase the use of digital technology. So this will enable patients to have a wider choice in how they access primary care services. But I must stress that if it is deemed appropriate, the patient would be seen in a practice. Also looking at how we widen the range of healthcare professionals working in primary care, and also support the ongoing development of new models of proactive, coordinated and personalised care that promote shared decision making to enable high quality care to be delivered closer to home, and coordinate general practice through primary care networks, ensuring that we're delivering the new service requirements to improve the outcomes of our population. And my understanding is the primary care strategy will be discussed at a future scrutiny committee, which is January 2021. Sorry, I rattled through that quite quickly.
No, thank you very much, Juliet. A lot of information. It will actually link into the following report that Stephen is about to give. I've got two members, Juliet, wants to ask questions. Councillor Owen Temple and Councillor Patricia. Oh, I've got three now. Councillor Patricia Joplin and Councillor Shirley Quinn. So, Owen, would you like to go first?
Chair, yes, thank you. I wanted to pick up on total triage. I think we have to be pretty careful about this. On Wednesday, I had a call from a lady awaiting an urgent operation who was told by her surgeon's secretary to ring her doctor. She had a heart problem and after double mastectomy and implants many years ago through cancer, she had leaking implants, which was the cause of her problem. She rang me because for 2 consecutive days she'd spent an hour getting through to her surgery and was then told there were no telephone slots available and to ring back the next day. Now, I've been trained in this committee, Chair, with your help, and I knew that I should tell her to ring 111 because they had direct appointments. So I did that, and she rang me back half an hour later to say they'd recommended her just to keep telephoning her surgery. Now, I don't think we can have total triage whilst it's subject to what is effectively a lottery of telephone connectivity and connections. So unless we get a good front end on telephony, total triage will return us to the days we used to have in my surgery in Concert, where it didn't matter what time you had an appointment for, the first person in through the door sat in the first seat and was seen first. So we're going backwards, not forwards, if we're not very careful. Can we think about total triaging rather critically before we adopt it as our solution to the modern world?
Thank you, Owen. Patricia? Are you there still? No. While we wait for Patricia to join us, Shirley, would you like to ask your question?
Yes, thank you. Thanks very much, John. It's a bit of a personal note, actually. We live in Shildon. Our GP practices in Bishop Auckland at Bishopgate, but we've got a grandson that's 18 months old now, and apparently the health visitors are actually coming from Tees and Esk, and it will be somebody from Ripon that would actually do a visit on seeing on his well-being. That seems quite ridiculous, you know, really. Is that what is happening these days? And surely there must be a better system than that. You know, I mean, all those miles away, it just seems a little bit ridiculous. Thank you.
Thank you, Shirley. Patricia,
John, could I ask a question?
Yeah, we've lost Shirley. Do you want to take over Patricia, Rosemary, and then I'll take on everybody else? Okay, Rosemary?
This report causes me a great deal of concern. First of all, you've never mentioned mental health at all and how you will address that. On a personal note, my son is bipolar, as you all know, and he was asked to speak to a CPN that he'd never seen and he didn't know, and he refused to engage. It increased his stress and his paranoia. You're not looking at how these people can engage if they don't have the technology, because if you're on benefits, how do you afford the technology? Even just a telephone bill is an expense on £400 a month. So I think really there needs to be a lot more thought and consideration put into this report. The other thing is, I go to the Mental Health Strategic Partnership Board as a carer, and I've never been invited to attend a meeting for that for a year.
Thank you, Rosemary. Juliette?
With regards to the total triage, I will certainly take that information back, if that's okay, Councillor Temple. With regards to the service at Bishopgate, my understanding is that that is the service provider, so the teams will should still be local, but I will feed that back, Councillor Quinn, if that's okay. And obviously, Rosemary, yes, I'll take that on board, and again, I'll feed that back into the primary care team to make sure that your concerns are addressed, if that's okay.
Thank you, Juliet. I've got 3 members to speak, and I've got Sarah. So I've got Richard Bell, Councillor Richard Bell, Councillor Eunice Huntington, and I'll still try and find
Chair,
Patricia.
I'm here, Chair.
Are you? Right, yeah. Patricia, do you want to go first?
Thank you, Chair, because it's actually to do with Owens. It isn't quite the same point, but it's come to my notice that these television phone consultations, they need to be appropriate for the condition. I've got one lady who needed to have her an examination on her eardrums, which she was sent from the audiology, and it was a telephone consultation. Now, I'm sorry, with the best will in the world, you can't look at somebody's eardrums through a telephone, and I do think that we need to look and see if that telephone conversation, or even one that's done virtually, is appropriate for that condition. And that's one of the things that I think we might, I mean, that can't be the only case. There must be many that are going on, and people are totally bemused as to why a telephone conversation is happening when they need actually a physical examination. Thank you, Chair.
Thank you, Patricia. Richard?
Thanks, Chair. Yes, I just want to build on Owen's and Patricia's points just there. The modern technology has its place. So if I want to talk to my doctor to sort of say, do you still need those prescriptions or whatever? Yes, telephone, video chat is fine. But equally, it has its limitations. And my nephew is a GP in Liverpool, and he says, yes, it saves time on the one hand. On the other hand, he says, I'm wasting a lot of time because there's a lot of people that I can't actually diagnose properly without seeing them. So I'm basically finding I'm spending 5 minutes talking to them on a Zoom call, and then I'm actually having to say, you'd better come into the surgery anyway. Now he's doing his job properly. But I do worry that we are erecting barriers to proper treatment, and also in terms of people getting access via Zoom or phone or whatever. Again, we as councillors have had the privilege of having our hands held by good IT people, and I'm okay with that now. I'm quite happy to do most of my medical business by Zoom now, but I wouldn't have been had I been an ordinary member of the public, frankly. I think I'm one of those people who would probably have been kind of frightened off a little bit. And I'm not a man who makes a habit of going to the doctor. When I need to see a doctor, I need to see a doctor. And I do, yes, it has its place. And certainly in these COVID times, it has a very big place. But I am kind of concerned that the tone is that this dash to technology is the panacea for primary care. It has its place, but its place has its limitations. So please do bear that in mind. Thank you.
Thank you, Richard. And then the last one is Eunice, and then we'll go to you, Juliet, and to Sarah. Eunice, Councillor Huntington.
Right, can you hear me?
Yes, we can.
Right, okay. It's just really following on with similar story to the people who've spoken before, but telephone appointments are limited. My sister-in-law went with symptoms of bad indigestion, pain in her chest, pain in her arms, in her neck, in her teeth, and they focused on the indigestion. And she was backwards and forwards, really for a couple of weeks, until the end she was so desperately poorly, she almost crawled to a different doctor, went to that surgery and asked if she could be registered with them. As soon as the receptionist and the doctor saw her, she was whisked off to hospital, blue light flashing, they were waiting for her at the other end, and she had a stent fitted and she's still not well. But that went on for weeks, and it's just really illustrating the point that the other speakers have said, how, you know, a telephone appointment has its uses, there's no doubt about that, and we've got to be inventive and innovative. But when there are times, or people, even receptionists perhaps, need to recognise certain symptoms, and particularly pain in the arm, chest and teeth and so on, that maybe there's something other than indigestion going on.
Thank you, Eunice. Juliet, clearly we'll come to you. There's 3 questions there, and then we'll go to Sarah. Juliet?
Yeah, I think what should happen with total triage is you obviously telephone, you get your telephone appointment, and you're absolutely right, Councillor Joplin, you cannot diagnose an ear infection on the telephone. And what should then happen is they should be offered a face-to-face GP appointment, but the GP or the nurse, whoever's doing the call back, should then make that clinical decision. But again, I will feed all of this back in to make sure that all the points are captured. And I think you're absolutely right that telephone appointments do have the limits, and we need to be really mindful of that as a CCG and how we take that forward. I think, have I answered all the questions? I think we were all about around the same things, weren't they?
Yeah, thank you, Juliet. Sarah, you would like to come in?
Yeah, it's really to echo a lot of the comments that Juliet has made, and also that the members around the table have made. I think telephone contacts have their place, and in some cases they work, they are the right thing. It's bearing in mind at the moment we're still very much trying to reduce footfall where necessary, so not bringing people into an environment where they could be at risk. But I'd hope it would give you comfort to note that our GPs are saying exactly the same thing. There are occasions where telephone contacts work, and there are occasions where they absolutely need to see the patient face to face, they need to examine the patient, and they're working through, this is a new technology for us, and working through some principles and ways of working for that. I think in response to Owen's question, if it's possible, Owen, could you ask for permission to share the details of that case so we could actually investigate and follow up what happened, because I think that's an important one for us to look into. And in terms of Rosemary's comment, as well about mental health. Yes, I agree, it's really important, Rosemary, and work has been done to streamline some of the contact process for crisis services throughout COVID, and it may be something that the committee's interested in having a focus on, because we've focused on primary care today, and I know this is a follow-up from previous work that we've done, but perhaps having a focus on mental health during COVID in a future session, because it's an area of where we've seen significant growth and our providers are working hard to address that pressure.
Thank you, Sarah, and I know Stephen has got that in hand, because it was one of the things we did raise, mental health. But thanks for your interjection, Sarah. Helpful as always. What it has done, but is it's got two people wanting to come back. So we've got Owen, Councillor Temple, and then Patricia, Councillor Joplin. Owen?
Thank you, Chair, and thank you, Sarah. Yes, absolutely, I have the permission of the lady. If after this meeting we could set something up, because for me there are two issues here. One is triage, and the other is the appointment if you can get through. So I do think that's important. But thank you, Chair. Yeah, we'll have that discussion offline. Thank you,
Owen. Patricia?
Thank you, Chair. It was just for clarification. The incident I was telling you about the ears was actually an appointment at the ear, nose and throat clinic via a consultant and not a doctor. So I don't want to blame the doctors for this. This was from the hospital, and I just thought to myself, you know, when I was being told, this sounds totally ridiculous. You know, thank you.
Thank you. So thank you very much, Juliet. Thank you much, Sarah. We were asked to note the report and look forward to the follow-on report in January, which obviously will take on board what's been said. So thank you very much, Juliet. So we now move on to item 9, which is the review of GP services. This is going to be presented by Stephen Gwillam, the Principal Overview and Scrutiny Officer. Before we do, I would hope that members who were on the working party with me would support what I'm about to say. I would like it minutes our thanks to Stephen for all the work he did in supporting that group, all the work he's done in preparing the report, and to be honest, all with the work Stephen does in preparing this committee. So with agreement, can we minute our thanks to Stephen for the work he did on this report? Thank you. So over to you, Stephen.
Thank you, Chair. The report before members today details the draft findings and recommendations from the committee's review into GP services across County Durham. Members of the committee will recall back in 2018-19, the committee was engaged in a number of applications to review, merge or close GP branch services across County Durham. And as part of those consultations, we heard evidence from representations from patients, from GP practice themselves and councillors regarding the potential cumulative effect of these proposed changes, and that informed the decision to take the review of GP services. So with that in mind, we agreed terms of reference in January, which are detailed in paragraph 3 of the cover report. That's page 385 in the pact. And that involved examining the roles and responsibilities of both NHS England in terms of national policy and the County Durham CCGs in terms of local policy for commissioning general practice services. We were to look at the extent of GP coverage across the county and also the current process for and ratings given by the monitoring of GP services by the Care Quality Commission. We knew at that time that there were a number of workload and demographic pressures being placed upon general practice, which were impacting on the availability and access to GP services. So that featured largely in the evidence gathering. And we also sought to find out patient feedback and satisfaction with GP services in the county. And again, that was done through a number of reports with the help of County Durham Health Watch, but also we examined in great detail the NHS National General Practice Service survey of patients. We examined a number of work proposed and initiatives considered by the CCG in general practice in terms of addressing workforce pressures and the recruitment, retention and training up of GPs within the county. And I think also the council's role, importantly, in developing, delivering and contributing to sustainable transport solutions that facilitated access to GP services. So the working group met 6 times and took evidence from a wide range of organisations and colleagues within the County Council. So both CCGs inputted into the review. We had a specific session by North East Ambulance Service, who obviously operate the NHS 111 service. We had representatives from the Care Quality Commission's local inspectorate come in to give evidence, as well as the chair of County Durham and Darlington Local Medical Committee, and officers within our public health, planning policy and integrated transport teams came in to examine and explain the County Council's role in terms of accessing and facilitating general practice services across the county. And in terms of specific reports, again, I've referenced the 2018 GP patient survey, but we considered specific reports by Healthwatch into the introduction of and patient views on the care navigation process. We had a specific report on access to GP services that was commissioned and undertaken by County Durham Healthwatch, and also their review of 8 enter and view visits into general practice. I'd referenced the key findings within the review set out from paragraphs 11 to 33, which have informed a proposed 9 recommendations detailed at paragraphs 34 onwards. And I'll just take members through the recommendations, Chair, if that's okay. In terms of recommendations 1 and 2, they're largely relating to the provisions of the long-term plan, the NHS long-term plan, the development of primary care networks, but I think also the proposed levels of investment that were reported to the working group in terms of improving and increasing the staffing resource and skills mixes within general practice. The working group heard evidence around plans to introduce additional skills into general practice, such as community pharmacists, physiotherapists, advanced nurse practitioners, the use of community paramedics, to actually expand the source of service available through general practice. In terms of recommendation 3, the recommendation there relates to the findings of the review of care navigation undertaken by Healthwatch Durham. We've obviously had a conversation around that process and accessibility to GP front of house services in the previous item. So it's important that we have a robust communications and engagement strategy, and that's something that needs to be considered when the CCG are developing their primary care strategy in terms of how care navigation is explained and promoted across GP practices. And I think given the fact that we've obviously switched to the method of service delivery because of COVID, I think it's also important to revisit the training provided to general practice staff as part of that care navigation introduction. Recommendation 4, again, we've talked about the promotion of alternative methods of accessing primary care appointments, so utilising new technology. And again, I'd just like to highlight within the report, the survey work that was undertaken did identify that the actual use of online and telephony to access services was very, very low across County Durham. And I think that's changed by necessity because of the situation we've found ourselves in as a result of COVID-19 and the restrictions placed upon actually physically accessing general practice. So I take the point that was made in the previous item around the appropriateness of using new technology, but I think there is a role for that to be played in. And again, the promotion of that alternative methodology of accessing general practice. I think recommendation 5 is really around the importance of using local intelligence, be that from bodies like Overview and Scrutiny committees, but I think also the patient involvement groups that attached to general practices to be tapped into as part of their new revised inspection regime. What I would say in terms of current ratings in County Durham, we are in a really positive position that we've got a significant percentage and proportion of our practices that are either outstanding or good. The use of Section 106 agreements to contribute to enhanced services, that was something that was picked up on due to considerations of kind of population growth and the impact that that may have upon future demand for general practice services, and the utilisation of planning policy agreements to contribute to enhanced health services. Integrated transport solution recommendation 7 to support people to access GP services to be undertaken by all relevant agencies, and I think importantly also an associated marketing and comms plan to be attached to that, because it's not just about having a solution there. I think it's important that providing information to the public around what is available to access is very important. Critical element to this is the various initiatives introduced both nationally and locally by the CCGs in terms of addressing GP recruitment and retention, specifically tapping into the 2 universities that obviously we get GPs qualifying from, aiming to seek their retention. But I think also importantly is the identification and use of the CCG's practice vulnerability toolkit. And we've considered examples specifically in terms of engagement of this committee in terms of GP mergers and closures, so that with the development of primary care networks, we now have an ability, or there is an ability for GP practices to work collaboratively and share staff across that to manage any workforce pressures that may be evident in terms of general practice within the county. And the final recommendation, Chair, relates specifically to the NHS 111 service. Again, in the previous item, we've had a number of members raise concerns and issues around the ability of utilising the function to directly access GP appointments via the NHS 111 service. So I think it's promoting that as a service, but also I think it's about ensuring that the service is fit for purpose and appropriate messages and promotion of this is undertaken by our CCGs, but also in conjunction with NIAS as the provider of that NHS 111 service. So those are the findings and recommendations, Chair. In terms of today's committee, I've asked the report recommends that members note and comment in respect of the report. The full report's attached at Appendix 2, and also we are recommending that the report is submitted to Cabinet at its meeting on the 16th of December 2020. Chair, on that latter recommendation, the 16th of December is a nominal date that we've identified, and that was largely subject to members' response and comments on today's report. In the event that members are accepting the report today, we can aim to hit the Cabinet report in November. So December worst case scenario, but if members agree the report today, then we'll aim to get that to an earlier Cabinet meeting in November. That's the report and recommendations, Chair. I'll take any comments or questions from members in respect of the key findings or recommendations, Chair. Thank you very much.
Thank you very much, Stephen. We've got one member wishing to come in. Councillor Tucker. Tanya?
Thank you, Chair. It's just a question really around paragraph 12 of the report, Stephen. The merger of the 2 CCGs, DDES and North Durham. In paragraph 12, it says that the merger of them to form a single CCG for County Durham will require a new county-wide primary care strategy to be developed. It was always my understanding that the 2 CCGs worked hand in hand anyway with regards to primary care. I'm just wondering how far that new strategy has been developed, if it's still in the planning process, and when we can get sight of it.
Chair, if I can come back in, I think the reference to the emerging primary care strategy was made in the report by Juliette at on the previous item. So within Juliette's report, there is reference to that emerging primary care strategy. I think importantly, at the time of the review that we undertook as a committee, we were dealing with two separate CCGs within County Durham. So we had North Durham CCG and DDES CCG. Now, both of those CCGs actually had their own individual primary care strategy, and a lot of the priorities within those two documents had a degree of synergy. But obviously, because of the fact that there were two organisations, there were specific locality priorities unique to their individual circumstances. So I think that the reference in my report to committee today in terms of our GP investigation, basically it's looking to ensure that the findings and recommendations that we are seeking to make as a committee are used and are able to influence and shape the emerging county-wide primary care strategy. And I think Juliette, in her previous presentation, referenced the fact that we'd be looking to bring a report on that emerging strategy back to committee in January, early in the new year. So the reason the two reports are adjacent to one another in the agenda are because of the fact that we're conscious that a county-wide strategy is being developed and is emerging, and the findings of our review report we'd like to see influence that developing CCG strategy, primary care strategy, if that makes sense.
It does, Stephen. Thank you for the clarity. Thank you.
Thank you, Tanya. Thank you, Stephen. So we have a motion that we agree and accept this, and that we refer it to Cabinet in whichever meeting we can get it to. Can we agree? Great. Thank you very much. OK, thank you, Stephen. So we now move on to item 10, which is the performance management. We've got Angela here. Angela Harrington. Good morning, Angela. Could we ask you to... sorry, Stephen, did you want to speak?
Apologies, Chair. I was just going to remind members that as well as taking the report to Cabinet, obviously subject to Cabinet consideration, we would be looking to share the report with the Health and Wellbeing Board, but also with the CCG's governing body and executive board.
Thank you, Stephen.
Thank
and
you.
Eventually full council. So we now goodbye to Sarah. It was nice here joining us, Sarah. So now we're over to Angela. Angela, we're all yours.
Thank you, Chair. Angela Harrington, Strategy Team Leader, Resources. So this is the first corporate performance report we've presented to committee so far this year due to the impact of COVID-19 on service delivery and on reporting processes. Although the Q1 period covers April to June 2020, this report also includes some Q4 data from 2019-20, where it's relevant to provide context. In future, we're going to develop the corporate performance report to reflect the reporting requirements of the new council plan for 2020 to 2023, which was agreed at Cabinet on the 16th of September, just last month, and also to reflect the COVID-19 recovery and restoration activity, which is likely to run over the medium term. So these changes to the corporate performance reporting will begin from Q3 onwards to align with new corporate planning arrangements, as well as developments in business analytics. So with regard to this Q1 report, I'm aware that the committee received updates at its meeting on the 7th of July with regard to the public health response to the COVID-19 pandemic and also the County Durham partnership system response to the pandemic. So at that point in time, committee was given information and assurance on activity during that Q1 period, which included how the care sector has been affected and supported. So with that in mind, Chair, I'd just like to draw out a couple of highlights with regard to performance from this Q1 report to committee today. So from the beginning of April, we had a new provider for the Stop Smoking service. And in response to the coronavirus, as we've heard in other reports so far this morning, the service moved to a proactive telephone support model in April. And this proved successful, particularly engaging with pregnant smokers. So the percentage of pregnant women setting a quit date during that period more than doubled when compared to the same time period last year. Data for this period showed a slight improvement for County Durham compared to 12 months earlier with regard to excess weight in adults. So that means the proportion of adults classified as overweight or obese, and it put County Durham ahead of the North East average, but still behind the national average. Obviously, with the impact of lockdown and the pandemic generally, we're all aware of the negative or detrimental effect on people's physical and mental health and well-being. So this is something we'll obviously continue to monitor. As a consequence of COVID-19 and the effects of lockdown during this period, we've seen big changes to demand for adult social care, which are reported. Obviously, there's a lot of work ongoing to analyse the reasons for these changes, what the data are telling us, and also what the provider market is telling us. The impact on care providers has been well documented, and Amanda Healy, our Director of Public Health, has obviously referenced this ongoing work and the support provided to care homes in her report earlier in this meeting on the local outbreak control plan. So we're continuing across all partners to work across health and social care to monitor and respond to issues as and when they arise, for example, through the Care Home Mutual Aid Group. And we're also improving the way we share performance data and intelligence to be able to support those who need care and support in our communities. So to conclude, Chair, we're asking committee really just to consider the direction of travel in relation to Q1, recognising the impact of COVID-19 on performance and the collective actions being taken across the board to address the challenges. Thank you,
Angela. I've got nobody wishing to speak, so can we agree that the direction of travel as proposed? Great, thank you. Thank you, Angela. There's a lot of hard work going on in all departments and we really welcome it. So we now move to Andrew Gilmore, who's going to do item 11, which is the forecast on revenue and capital. It's there. We've got it, Andrew.
All right, great. So clearly the first quarter of 2021 has been challenging for many reasons. And from an AHS budget monitoring perspective, the uncertainty, particularly at Q1, was significant. Therefore, the forecast presented today includes a number of assumptions which could change in time depending on the circumstances. I'll try and cover a number of issues throughout, so the suggestion would be leaving any questions to the end if possible, because I'll try and cover the required information and it may become apparent as part of the presentation. Durham County Council received a headline grant of £38 million in respect of COVID-19 cost pressures, although there are various other COVID-related funding streams which have also been made available to the Council. Over 21 million of the headline grant is being allocated to support pressures within the AHS budget, and this will be detailed as part of the presentation. I'll just take you on to the first real important slide. You see there's a table. This shows expenditure by type, and you can see that there is a cash limit under budget, as we call it. That's in brackets on the right hand bottom corner. That's 1.785 million. More information on the cash limit position will be set out in future slides. The third column from the right, entitled COVID-19 costs, that identifies £21 million, as I mentioned earlier, of the COVID-related cost pressures. This includes approximately £17.7 million of adult social care provider support, and I'll say more on that later. Other COVID-related pressures include £2.6 million for PPE for DCC use, and some additional staffing and double running costs for service users as a direct result of the pandemic. The second column from the right shows COVID underspends directly related to the COVID pandemic. This includes approximately £300,000 in respect of reduced transport costs, that's for both staff and service users, a reduction of £5.7 million related to activity in care homes, and a contribution from County Durham CCG towards the cost of adult social care provider support. The next table shows the same overall information but split on a service basis. You can see from the table hopefully that the head of adults area is has most of the significant spend and activity. In terms of the EHS cash limit position, a circa £1.8 million underspend equates to approximately 1.4% of the net budget. From a finance perspective, this indicates an ongoing, well-managed approach to budgets across the service. The adult care area shows a non-COVID related underspend of approximately £500,000. This is mainly in respect of employees and some care activity. As indicated previously, there remains considerable uncertainty regarding this area of spend in particular. The central costs area includes £1.3 million of unallocated funds. Options for future use are currently being discussed within the service. The commissioning service was broadly on budget at Q1, with 17,000 of additional income above budget receivable. Budget is on target to show a balanced position at year end after allocating 161,000 for future investment. The test and trace grant identified, which is what Amanda referred to earlier, which is approximately £4.5 million, and that's to develop tailored outbreak control plans and not specifically linked to the national test and trace spend. So this is a grant which could be used, for example, to fund compliance officers. It's an easy one. There's no capital programme at present directly linked to EHS. So for this presentation, try to identify the 5 main areas of support, just to give a flavour of the extensive range of financial measures which DCC has provided to the adult social care providers in response to the COVID-19 pandemic. So the first one's the advance payment. So following national concerns regarding the sustainability of the care market, the council followed national guidance suggesting that cash flow support was made available to relevant providers. Advance payments equal to one normal 4-week payment period were paid to providers in early April. These payments are fully recoverable by DCC in due course once sustainability issues decrease. Recovery will be made from future payments to providers. It should be noted that providers are generally paid in arrears for services provided, and therefore this mitigates the risk of non-recovery significantly. Total advance payments made were £13 million, although as the advances are fully recoverable, this is not shown as a COVID cost in the table previously discussed. The second one, in recognition of the significant reduction in activity for some care homes, Durham County Council, with support from the local CCG, has agreed to make sustainability payments to support the care home market. Payments are triggered if activity reduces by more than 10% from normal pre-COVID activity. An initial budget estimate was a gross cost of up to £7.5 million for 2021, and this figure is included in the earlier table. Sustainability payments are currently under review as part of the wider support measures. The third one there is stability payments, and these are being made to some providers, mainly in respect of daycare, to recognise the short-term reduction in activity as a result of the pandemic, for example, shielding. The stability payment in effect is a top-up to ensure the provider receives normal pre-COVID income levels for the calendar year 2020 and to help promote the future viability of the businesses in scope. The cost to the council for stability payments can be around £500,000 every 4-week period, depending upon activity. This cost is not identified within the earlier table, as existing budget has been used to fund this element. Fourth one mentioned, so in addition to the above measures, in recognition of national concerns on exceptional cost pressures due to the pandemic, DCC, with support from the local CCG, has made additional uplift payments to providers each 4-week period since 19th of March. Payments are currently planned up to the end of October, pending a further review. For most providers, this equates to an additional 10% uplift on top of their normal pre-COVID activity. The budget cost for 2021 is £9.6 million, and this is identified as a specific COVID cost in the earlier table. The last one I'd just like to pick up on is the Infection Control Fund. So this is the government initially made available to Durham County Council £6.7 million for the Infection Control Fund. These monies have been passported in full to providers, with 75% of the grant monies ring-fenced for care homes. The fund aims to reduce the rate of COVID-19 transmission in and between care homes and support wider workforce resilience. Further monies have actually just been announced recently, and also the free PPE has been mooted recently. So hopefully that just gives you a flavour of some of the support that's been given. I'll just open it up. Thanks for your time. Happy to take any questions on the report and the presentation.
Thank you very much, Andrew. Thank you for your time. You've got two people wanting to ask questions. You've got Councillor Tucker and you've got Councillor Bell. Tanya?
Thank you, Chair. Thank you, Andrew, for a comprehensive report. My question is around infection control. The resource is across the county prior to the pandemic was always stretched, I think is the kindest word for that. And a lot of the work that that team does is centred around care homes, you know, for advice, support, etc. I'm just wondering if any portion of that extra money has actually gone towards extra people for that team to support with the greater need, or if the money is being utilised in a different way. Thank you.
Thank you, Tanya. Richard?
Thanks, Chair. You probably won't know the answer, Andrew, but I'll ask you anyway. But obviously the issue now with care homes is viability in terms of reduced occupancy, because obviously a lot of people now who would normally have gone into care homes aren't because of fear of COVID. So presumably, obviously they're being looked after in their own homes. I just wondered if you had any sort of feeling as to what the relative financial implications are for the council if that trend continues of fewer people going into care homes versus staying in their own home. I don't want to get into the whole debate about care home viability and whether they'll close and etc. etc. That's for the November meeting, I guess. But I just wondered that balance between care home, residential and residential at home supported by the council. Thanks.
Andrew?
Okay, I don't think I'm fully qualified to answer the first one. I just know from experience that some of that money is being used to cover double running costs for staff. How care homes have utilised that money is subject to the rules that the government set down, which they should be following, which is, as I say, to try and reduce the transmission chances. In terms of the second one, Councillor Bell, certainly we've seen an increase in home care recently, which may or may not be the future trend. But we're obviously just keeping an eye on that, and we'll see as we get further and further through the current challenging circumstances, we'll have a better idea how that shapes the care home and home care market in the future.
Thank you very much, Andrew. There's no more questions, so can we note that report? Great. I've got no any other business, so may I thank everybody for your attendance, and I hope you have a lovely weekend. Can I remind members that we need to wait shortly to allow the disconnection from the live link? Thank you very much.